request. Okay, so just quick before we get started, a quick housekeeping thing. Shannon did put into the chat box the phone number. So we do ask, if possible, for you to join by phone rather than using the audio on your computer, because it just tends to be better sound quality and eliminates the risk that we will get a lot of feedback if you unmute in order to ask a question. So, but it looks like we've got 20 people, maybe a little fewer if there's some duplicates on now. We had 25 registered, so I think it probably makes sense to go ahead and get started. Thanks everybody for being here with us this morning, and just to make sure you are in the right place, we are here today to talk about path monitoring, and I think Brenda Earl from DEMIS is going to kick us off, so I'm going to hand it over to Brenda.
Great, thanks. Can you just making sure you can hear me?
We can.
Yeah, we can hear you.
Okay, great. Thank you so much. I just wanted to thank all of our path providers for all of your hard work over this last year. I was just actually mentioning here, I think I'm about 11 months in to this position, and it's been so great just learning everything about PATH and working with you as providers and housing innovations. So thank you. So I just wanted to mention that, again, this monitoring process is a SAMHSA requirement. So every year, Housing Innovations will either do a remote review of your information, or they're going to come out and do a site visit. So just to kind of reiterate, that is a requirement with SAMHSA, and DEMIS works very closely with Housing Innovations to update this documentation, of course, with all of your provider feedback, which we did go over that on, what was our last meeting? I think 9/19 was our last meeting when we were kind of discussing all of these updates. So again, just keep in mind as we go through these documents to ask questions. We encourage you to communicate with us at DEMIS if you're finding that there's things that are just tough at your agency, or perhaps it's goals that you had set for yourself that maybe halfway through the year you're finding that we need to reset those goals. Just make sure you're keeping that communication open with DEMIS. The monitoring process is there to kind of make sure we're all at the same level of standards. It's not there to be a gotcha. It's not there to take away funding. It's really just there to make sure that we're all kind of on the same page with national best practices and just kind of what we're seeing as best practices here in Connecticut. I think that's everything that you guys wanted me to kind of touch on. Our next statewide meeting is December 19th. So again, maybe anything we go through with this webinar, I know we have limited time. Maybe write down questions that we don't answer today. Maybe we can address those at our next meeting on the 19th. And I'll be here, so if there's questions, I'm happy to jump in.
Great, thanks so much, Brenda. So I'm Lauren Peretti from Housing Innovations. I think I know most of you from coming out to your programs to monitor the past few years. And the other voice that you're hearing on the line is Shannon Quincherin, who I think most of you know also because she joined our team last year and did path monitoring with me and with Liz last year. So before we dive into the slides, just a couple of other quick housekeeping things. So we are scheduled for 90 minutes, and so we will definitely finish by noon. We may finish sooner. We hope that you guys ask questions, make comments, and you can do that. We will pause periodically to invite questions and comments, and you can do that by unmuting yourself by pushing *6 on your phone, or if you're using computer audio, which again, we suggest that you do not do that, but if you have no other choice, you can also unmute yourself on your screen. There's a little phone icon that says mute below it that you can use to unmute yourself. So we hope that you guys will ask some questions and we can have a bit of a conversation today, although I know that the webinar format is not the most conducive to that. If you have questions that you're not able to ask today, or you don't get the answers that you're looking for, like Brenda said, But you got a lot of options. You can call Brenda, you can call me, you can call Shannon, you can bring things to the quarterly provider meeting, you can email us, et cetera. So please don't let your questions go unanswered. Reach out if you don't get them answered today. So, again, so if you want to ask a question, it's *6 to unmute yourself, and then *6 when you're done talking to mute yourself back so that we don't get a lot of feedback on the line. Shannon, maybe you could get that information into the chat box as well?
Yeah, yep.
In case people forget. So, all right. Also, this presentation is being taped today, so we will post it to the website and send out a link to it when it's available. So if you've got folks on your team that are unable to make it, or new folks join your team, and you want them to be able to see it, that will be available. And then we will also be doing an evaluation. So after the session today, we will send out a link to a SurveyMonkey evaluation. And we do, if you can, please respond to that. It really helps us to know what you guys want and need and to make these sessions better. So hopefully we have all of our technical issues worked out. We apologize in advance if there are any technical glitches on the call today. So, all right, so I'm going to jump in. So this is our agenda. So all of your projects have been monitored now, I believe, twice. Everybody's been monitored at least twice, although you may not have personally participated twice, but all of the projects have been monitored twice. So we're going to talk about common findings from our last year of monitoring, so from the monitoring that we did in 2019. We're going to talk about why we monitor, what are our goals for the process, and those really haven't changed. We are going to do like a little bit of a brief overview of what happens during monitoring in case there are folks on the line who are totally new to this. We're not going to spend a lot of time on that because I think most of you have been through it before. And we're going to spend the bulk of our time talking about what's new in the monitoring guide in 2020, and also the new tools that we you guys asked for, and we worked with DEMIS, and DEMIS has now released. So those, both the updated monitoring guide, the guide that we're going to use when we monitor your projects in 2020, as well as the new tools, went out by email on, initially I think on October 25th, and then they've been attached to the webinar announcement reminders that Shannon has been sending out. They're also all on the BOSS website, so you can find them there. And as always, if you have difficulty finding anything, just let us know and we'll send it over to you. Today's session is not meant to be an in-depth training, right? So we do on behalf of DEMIS every year for the past 2 years, Housing Innovations has been doing a full day more best practices and service delivery kind of training for outreach teams. And we are going to do that again. And we have tentatively set the date for that for May 8th, but we are still working on confirming space for that. So if you want to, you can go ahead and hold it in your calendars. Again, it's May 8th. But we will get an official save the date announcement out once we've got space confirmed. All right, so we always like to start off just by acknowledging the juggling act that your teams are doing. We know that you guys, outreach is tough work, right? You've got limited resources, and with those limited resources, you're tasked with covering large geographic areas and, meeting some extremely intensive, high-risk needs of folks who are very, very vulnerable and living on the street. And so we get that. I know the folks at DEMIS get that. And so our goal really is to think about together, okay, given the resources that exist, right, how can we together make our approach to outreach as coordinated as possible, and as effective as possible, of course, of ending street homelessness. And so that's really the spirit in which, DEMIS started, I think, the monitoring program back in 2017 and the spirit that we try to carry forward with us as we monitor your programs every year. And each year we do adjust the guide a little bit based on questions that you guys have asked and things that have come up and things that we've learned. You'll be happy to know that I don't know if people had a chance to look at the updated guide that we sent out recently. There are not a lot of substantive changes, and we will go over what the substantive changes are today. So we totally get, right, that each CAN is very different, right? Some of you guys are working primarily in urban areas where there are lots of unsheltered homeless people in a small geographic area, and sometimes there are multiple social service providers that are doing outreach services, and in that circumstance, obviously coordination becomes more critical. And then some of you are working in small towns or even rural areas or suburban areas where there aren't nearly as many unsheltered people. They're spread out over a broader area, and your team might be the only homeless outreach that's happening in the entire region or even the entire CAN. And so that said, right, the monitoring guide really is a statewide document, right? So not everything in the guide is going to make sense for every single project. And so we'll talk today about what to do if you think that one of the standards either just doesn't make sense for your program or isn't doable given the resources that we have. Because we know all of these things that are on this slide are things that your teams are trying to juggle. And sometimes not all of the standards. It might be a best practice, right? But it might just not be possible given the resources that you have. So, okay. So these are our goals with monitoring, right? So these have not changed. We're trying, of course, to help support you guys to get people connected to housing and the services they need as quickly as possible, to reduce how long they're spending homeless. We're trying, of course, to help people reduce their risks while they are still living outside or wherever they are living. Obviously, we know that folks who are unsheltered face a lot of risks. We're going to talk a little bit in a minute about some recent research that really underscores that. We're trying, where there are multiple providers involved, to minimize the extent to which there's any duplication of services because the resources are so scarce and so precious. And again, trying to come up with standards that really help to ensure that we're using the resources as strategically as possible and that we're prioritizing the folks who are most vulnerable and who have been homeless the longest. So there really still is not a lot of really solid data out there about what drives unsheltered homelessness and what works to end it. There was a study that came out in the last year by the California Policy Lab where they took some SPDAT data from org code and they compared the data for unsheltered people to the data for sheltered people. And really had some pretty stark findings that showed that health and behavioral health care needs, abuse, and trauma are major factors in housing loss among unsheltered people, particularly women, way more so than among sheltered people. Now, that's probably not news to any of you who've been working for a long time with folks out on the street. But I think that the level at which the difference that they documented is what, to me, was surprising. So when compared to sheltered people, unsheltered people were more than 4 times as likely to report physical health conditions, nearly 3 times as likely to report mental health conditions, and more than 8 times as likely to report substance use had contributed to loss of housing. So that's a little bit of information that we have at least on, some of the factors that are driving people to be unsheltered homeless. We also know from an analysis that was done by NAEH that, a lot of times we think, oh, well, obviously the solution to homelessness is housing, right? And of course that's true. But, you guys know that's not the only part of the solution, right? So when NAEH did some analysis, they looked at availability of units for people that are very poor, and whether or not that tracked to the rate of unsheltered homelessness in the community, right? So what you would expect to see, right, is that in a community that had more units available to people who are very low, you would see fewer, a lower rate of unsheltered homelessness, but that's in fact not the case. They did not see those two indicators track one another, so that's a little counterintuitive. And then similarly, they also didn't see a connection between decreases in temporary beds for homeless people and rates of unsheltered homelessness. So again, you'd think that if you, for example, reduce your number of sheltered beds, that would mean that you would have more unsheltered people, but the analysis that they did not show that. So all that is to say that we know that the problem of unsheltered homelessness is super complicated. We do not certainly purport to have all of the answers, and we really are just trying to work with you guys to figure it out together. So this is just the unsheltered count starting in 2007, which I believe was the first year of the count in Connecticut up until last year. And the most notable thing here is the tremendous success that you guys have. So just wanted to say congratulations and thank you for that work. We can see from this that from 2007 until 2019, unsheltered homelessness is down 43%. So the other thing that we see here is that it's not a steady trend downward, right? So some years it goes up, some years it goes down. We know in part that's driven by weather, right? When it's colder out, the count is lower. Some of it is driven by methodology. We'll talk a little bit in a minute about a particular methodology item that we want to make sure that is on your radar. Last year there were a bunch of, or not last year, but in 2018, there were a high number of observational surveys done in one of the communities, and that sort of drove a little bit of an uptick in that year. And this kind of up and down line that we see here is similar to what we see in the rest of the country. So overall, right, unsheltered homelessness is down as well in the rest of the country, but most COCs do not see a steady trend line going down. Although you guys are ahead of the pack here in Connecticut, so again, kudos. As I said before, you're down 43%, and I think nationally, the latest data that they've released, which I think is from 2018, shows that nationally it's down 12%. So you guys are quite a bit ahead of the rest of the pack. So I just wanted to really quickly, while we have you guys on the line here today, give a plug to how incredibly important the block group selections are. So the accuracy of the count is super important, right? And it's super important because it's the thing that we use to measure to know whether or not what we're doing is working and whether we should keep doing more of it or we need to try something different. And it's also really important, unfortunately, because it's part of what determines how much money we get as a COC for new programs to house homeless people. And so when our count overall, including our unsheltered count, goes up, we get fewer points in the annual competition for those federal funds, and therefore we get less money. And so the accuracy of the numbers is really super important, and the accuracy of the block group selections is super, super key to the accuracy of the overall count. And I'll just explain what I mean by that really quickly, and then we'll move on. So every year, those of you who've been involved in the past know that every region in the count tells CCEH, the organization that for people who are new and might not know, is the organization that convenes the annual point-in-time count every year. And you guys tell CCEH, right, which block groups, so which areas of your community you are pretty sure there's a high probability that you're going to find somebody who's unsheltered, and which are low probability. And when you go out and you actually count on the night of the count, every person that you find in a high probability block group counts as one person, right? Because you canvass all of the high probability areas, right? when you find somebody in a block group that you've designated as low probability, a multiplier gets applied because you don't canvass all of the low probability areas. So the methodology assumes that since you didn't canvass them all, there were more people out there that you didn't find because you didn't canvass all the low probability areas. So every person that you find in a low probability block group, right, may count as, it's going to differ from community to community, but it might count, for example, as 10 people, right? So you really want to make sure that that you are designating enough high probability areas so that you're pretty confident that all the people that you find, obviously you can't ever be 100% confident, but that to the best of your ability, you've designated all the places where you think you're going to find people as high probability areas. I'm going to pause and just invite if anybody has any questions so far. And again, to ask a question, you can press *6 on your phone to unmute or use the feature on your screen with the little phone icon that says mute, unmute.
And while you're thinking about questions, I just want to emphasize, like Lauren's saying, the outreach teams are the people with the best, most accurate information on those block groups. So that's why we're kind of emphasizing this right now. Nobody knows better than you all, than outreach staff, where those unsheltered homeless are living and staying.
Hi, Lauren. It's Stuart Lane.
Hey, Stuart.
Hi. You know, the word unsheltered, it's a little ambiguous in the sense that we have shelters and we have clients out in the streets that either haven't gotten into a shelter or don't want to go to a shelter. So when we use the word unsheltered, even in the PIC count, because MFAP does the PIC count for this area, are we always talking about people that aren't in the shelter or people that just have nowhere to sleep? You understand my question?
Yeah, absolutely. It's a great question, Stuart. And so we've been using unsheltered as kind of a shorthand, but the definition really is the HUD definition. So it's people living in places, you know, not meant for human habitation, right? So it includes people who are literally sleeping in the streets or in the park, right? Literally outside without shelter. But it also includes people who are spending the night at the train station or living in someone's shed or living in an abandoned building. It does not count people who are in shelter, and it does not count people who are in any kind of housing program, of course. It does not count people who are in the hospital. It counts only people who are actually living in a place not meant for human habitation on the night of the count.
So
does that answer your question?
So, yes, but so you have sheltered that are staying in a shelter, but then you have unhoused that have yet to be housed, correct?
So you've got, I'm not sure what you mean by housed. So you've got, yes, you've got.
Meaning like, you know, living in the shelter is not housing, it's temporary. So yes. Unsheltered goes to, if you want to not be unsheltered, you can either go to the shelter or you can hopefully get your name up by name list and eventually get housing.
Yeah, gotcha. So yeah, so we count both kinds of people in the count. So we count both the sheltered homeless and we count the unsheltered homeless, right? So both of those, so people who are living in a shelter or transitional housing count in the sheltered count. And then HUD distinguishes that from the unsheltered count. So what we're talking about today, and really the focus of the PATH programs, really is on the folks who are unsheltered. So people not living in shelter, people living in places like parks, train stations, abandoned buildings, et cetera.
This is Brenda. Can I just jump in real quick?
Yeah, sure. Please do.
Just because, Stuart, I heard you just say shelter was temporary. I don't know if what you were referring to, meaning that was like temporary housing, but people in shelter are still homeless. So it's important to keep that, like Lauren's saying, unsheltered is homeless, living in places not meant for human habitation. And if you actually have a shelter bed, you're homeless, but in a shelter. So right. It's not a temporary housing option.
No, it's just a temporary sleeping option.
Homeless option. Yeah, perfect. I just wanted to make sure that's what you meant.
I got it.
Great. Thanks for the question, Stuart. Do other folks have questions before we keep going? All right. We'll pause again, so no worries if you didn't get a chance to ask your question. So I'm actually going to turn it over to Shannon, and she's going to cover the next few slides so that you guys don't have to listen to me talk for 90 whole minutes.
So we wanted to share some common monitoring findings from the visits that we've already done. First and foremost, we continue to be extremely impressed by your teams. It's evident, abundantly evident by our visits that your staff care deeply about their clients, and the clients with whom we've spoken feel respected and cared for by your staff. And in many cases, your staff are the only people that your clients can say that about. We continue to see a lot of great relationships happening, and a lot with creativity, which is definitely needed. Outreach staff don't give up on people. They just keep trying new and different techniques, coming back and back. Again, if something's not working. I've had the opportunity in my community to attend case conferencing meetings on chronic homeless, and I was talking to one of our seasoned outreach workers who worked with veterans who had some success in getting some long-term homeless people a house. And I asked him, I put him on the spot, I asked him if he knew any specific techniques that worked, and he thought about it for a couple of minutes. And then he looked at me, he looked at other people in the group, and he said, "You just keep loving on them." That was his answer to me. So, so that's what we see. We see that evident in the techniques that you are all using with your clients. All right, next slide. More common findings. As part of our job at Housing Innovations is to help clarify the funder requirements and make them transparent to the providers. PATH projects are more consistently focused on street outreach than they were prior to monitoring. There's less focus on in-reach and office-based services and more going out into the community. Safety protocols have improved. So, for example, there's more clarity on when it's okay to do outreach alone and when it should be two people or more, promoting partnerships among agencies so that we can avoid single workers going out, putting them in an unsafe position to a place that's not publicly visible. Intended use plans, or IUPs, and contracts do not always consistently define the core expectations. So to that end, we're working on a template to make them more consistent and ensure that they are clear on the contacts, the number of contacts, and the number of enrollments that are required per year, and to ensure that that information is codified in the IUP so everyone has the same understanding of what the expectations are. In some cases, as y'all are very aware of, staffing levels may be insufficient to meet the requirements included in this monitoring guide. And as Brenda was saying earlier, if something in the guide does not make sense or is not doable for your program, as Lauren alluded to, there are many different areas, urban, rural, where some things may or may not make sense for your area. So talk to Brenda to determine if the requirements may be waived. We have found that the vast majority of agencies have not taken advantage of this option.
Shannon, can I just jump in?
Oh, yeah,
sorry, it's
absolutely.
Brenda. It's Brenda. If I can just also note on the bullet, the previous bullet, the intended use plans and lining them up with the contracts. Again, that is, SAMHSA requires each provider complete an intended use plan each year. So DEMIS usually sends those out around the time that we're reapplying with our application to SAMHSA. So that's really the time to look at, you know, your capacity, your staffing, your goals, your outreach plans, kind of working with your CAN to kind of see what the need is and what the staffing capacity is, and complete that template, which again, Housing Innovations and DEMIS, we're kind of working on an updated template. But just to keep in mind that the provider sets those goals. So just, you know, remember, if those goals, if you're looking back at your plan and it looks like you need to make changes, just communicate with DEMIS and we'll see if it's something we can change with SAMHSA. But DEMIS didn't set those goals. Usually the agencies are setting those goals. So just take a look at those plans and let DEMIS know if there's any issues. Thank you.
Thank you. Okay, the more common findings. Documentation varies widely. Some staff document little and don't see the value. More about documentation on the next slide. Most projects are not using a consistent system to record client locations and ensure that clients can be located when the primary worker is unavailable. Again, more about that coming up. Most projects don't have a coordinated CAN-wide outreach plan. This was a new requirement last year, which had several elements included in it. So again, Lauren said this template was sent out with a webinar announcement to help develop a more comprehensive plan, and more about that in upcoming slides. Providers, as I'm alluding to, have consistently requested tools to help them meet the requirements. Next slide. Why is documentation important? Outreach clients are often great at flying below the radar. They're going unnoticed and trying to go unnoticed. Documentation helps to make sure, one, no one falls through the cracks and everyone has someone checking in on them. And then to ensure every unsheltered person is prioritized and connected to housing as quickly as possible. Outreach clients are also great at surviving and getting what they need. And sometimes that means they continue to ask different people, possibly many different people, for the same thing. The documentation helps to conserve scarce resources and avoid service duplication. And this is where documenting in HMIS can be super helpful, where it's shared across providers. So different providers working with the same client might see that they don't need to get certain things done, or they may call one another and decide who's going to be the primary person on this client. We know that outreach clients have a super high rate of victimization and trauma. And we also know that being predictable and reliable and not forcing people to explain the same things over and over, tell their story over and over to different people, these are extremely important elements of trauma-informed care. So clients need to know what they can expect from your team and that you're going to follow through every time. Documentation helps to establish clear roles and responsibility and ensure that commitments that are made are kept. And then to ensure that other people can find your clients, know something about them and what you were working on together in case you are not available to continue to provide services. Next slide.
So I just want to say really quick, I think this is a shift for a lot of the staff on your teams, right? Like, so when we first started doing monitoring back in 2017, there really were not clear documentation standards for the PATH program. And I think most programs were doing little to no documentation. And so we get that for folks that have been doing this work for a long time, this is a big change, but I think for all of the reasons that Shannon just talked about, it's an important change, right? Because it's important for all those reasons to make sure that we're delivering the highest quality services possible to people, and that we're using the resources as efficiently as possible. We do really try hard just to like have the bare documentation minimum, right? We are not trying to overburden outreach workers with tons and tons of documentation. So if there are things that we are asking for that you think are excessive and don't serve a value, please let us know. And like we said earlier, every year we do make changes to the monitoring guide. And I think that the quarterly meetings that you guys have with DEMIS is a great forum for bringing those concerns forward. But our goal really is documentation that matters to clients, not documentation for document's sake.
Right, right. I'm seeing Vera asked a question. Can you go deeper into the CAN outreach plan? I think you're covering that later, Lauren.
I am going to go through the CAN outreach plan later, Vera. People,
yeah, but if
I don't know if people can see that, but
go ahead.
If you prefer to ask questions in the chat box, I don't know if people can see that question, but you should all be able to see the chat box if you're using Zoom. So please feel free to ask questions that way also.
Yeah. Okay. So we were talking about tools that can be helpful. As we've talked about, the first two listed here, the outreach plan and the assessment and service plan, are new, and they were sent out with the materials for this webinar. The housing target tracking tool is available on the CT BOSS website in the resources section under path monitoring. So we would love for you to look at those tools, use them, play around with them. If you have suggestions on how they can be better, please bring those to the quarterly meetings, because as Lauren's saying, for everything, we want this to be useful. We want it to be as useful as possible and hopefully make your jobs a teeny bit easier. So we really appreciate your feedback, and we look at these as kind of living documents that can be changed. And coming soon, we're working on the consumer survey and an IUP template. Next slide. Implementation timeline for these new tools. So 11/14, tomorrow, or today you're going to start working with these tools. Work with your CANs to develop the outreach plans and obtain CAN approval on them until the 28th, until the end of February. On March 1st, then outreach plans are due to DEMIS. So you will have worked with those and developed those with your CAN.
So I just want to say, so that just one quick thing, Shannon. So I just want to say, I think the thinking here, and Brenda, you'll jump in if I'm wrong about this, but that the plan should be approved by the CANs before they are submitted to DEMIS. So you need to work with your CANs, develop the plans, and get their approval, and then submit the plans to DEMIS by March 1st is the goal.
And if I could also add, again, this is Brenda, I have been in communication with the DOH CAN managers, Kara Capabianco and Lee Shields Church. So they're aware of this new document. They've looked it over. They know that this is going to be a process, and they can. So definitely coordinate with them if you're setting up a meeting or if you have any concerns. I'm sure they can be there to help guide this process as well.
Great. So from 11/14 today to the end of February, again, work with your staff to implement the assessment and service plan template. Again, play around and bring back comments as you will with the quarterly meetings. But we expect that you would work on a rolling basis as with clients. So as they're due for updates, use this new tool. As new clients are enrolled, use this new tool, and or existing clients are engaged in additional case management services, use this tool. For monitoring, what we would expect is the plans that are done, completed before 3/1, any format, if you have a format you're already using, would be acceptable. But from 3/1, from March 1st on, we would look for the plans to use this format. Okay, next slide. The elements of monitoring continue to be the same as 2019. What you can expect when Housing Innovations comes out to monitor in 2020. Basically, though there are some new requirements, the approach, as I said, will be the same. You send, and we look at some information in advance.
Can I ask you a quick question?
Yes, this is Stuart.
On the previous slide about the outreach plan, is that something that? So we have a contractor. So Catholic Charities is our the agency that contracts to us. Is that plan, that outreach plan, done by them, or is it done by us?
So great question. Great question. I'll take it. Great
Okay.
question, Stuart. So I think it's going to depend upon the can, right? So like in some cans, the way that the subrecipients are laid out, it's geographically based. And so basically you have to decide with Catholic Charities whether you guys are doing one plan for the entire can, right? Or whether it makes sense to do regional plans. And then, you know, I would think, although it's certainly, you know, up to you and Catholic Charities to decide and figure it out, if you're going to do regional plans, then the provider in each of those regions might be responsible for doing the plan. But we're not going to determine that. You guys have to figure that out. And we're going to talk about those things more when we get into going through the outreach plan more in depth.
Great, thanks.
Okay, so yeah, we ask for materials up front. You send them to us, and we look at them in advance. Then we meet at the beginning and the end of each visit. We look at your charts. We will go out with your outreach staff and see them in action. This is always our favorite part. Like we said before, the people that are outdoors, this is why we're doing the work that we do. And I wanted to share a quick story. One of the visits we did last year, we talked to a group of people, and we asked them what's going well, what's not going well. And one of the women said, and it just struck me, she said, the outreach workers that work with us here, they treat us like people. So just that being treated with human decency was not a common experience for these people. And it points to, like we said early on, the relationship building that you all do that really makes a difference in building that trust and dependable places that they're going to be seen, and you know they're going to show up at a certain time that really can assist people in taking steps to get into housing. So we talk to the staff while we're out doing those visits, and we talk with the clients as well when we can. And when we come back, we write a report, and then you submit a plan outlining how you're going to address any findings that might be in the report. Next slide.
So just real quick, I just want to make sure, so there are two things on the slide that you can see that we're only going to do when we come. So some of the visits that we do are going to be remote, like about half the visits we're going to do remote, and about half the visits we're going to do on site. And so obviously we're only going to do outreach observation if we come on site. So we skip that part for the remote visits. We also skip the consumer interview for the remote visits because we typically do that while we're out doing outreach. But everything else that you see here on this slide will happen regardless of whether or not you're getting a remote or an on-site visit. And we've announced all the visits already. So I believe all the dates are confirmed. Are all of yours confirmed, Shannon?
Yeah, the outreach ones.
Okay, so you guys should know when we're coming, and you should already know whether we're doing on-site or remote. And if you have any questions about your particular visit, please call. Either Shannon or I is leading each of the visits, so whoever sent you the notification, just call us with any questions.
All right, so as Lauren just alluded to, we tested remote monitoring in 2019, and in general, it was very well received. Providers that we asked for feedback from, they said that they found it more efficient and less burdensome. So as Lauren was saying, 5 projects will be visited remotely this upcoming year, and 3 will be on site. She said we already proposed a date, so you should know when your monitoring is coming up. So for remote monitoring, we limit what we review to new requirements in areas where there were findings last year. We send you a list of documents we want to see for specific clients a few days in advance of the visit. And then to ensure that the remote monitoring is in fact less burdensome for your teams, it's not a long list. It wouldn't be the same as on-site monitoring. So the options for us looking at documentations for the clients are to upload unredacted documents into client HMIS records. And in this case, you would give Housing Innovations time-limited remote access to your electronic record system. Same word. Then another option is to then redact, go through documents, black out any personal private information, and then submit those to Housing Innovations via Dropbox or email. Last year, almost all projects we monitored remotely for both PATH and COC used the HMIS option, and it worked really well. This is already a secure database. You don't have to worry about redacting. You don't have to worry about going and finding each piece of private information, dates of birth, social security, names, etc. So we would like to encourage the HMIS if that's possible. Our goal, again, is to make the process as painless as possible for all of you. So please let us know if there's anything in this regard that we can do to make this easier for y'all. Next slide. I think there's a question in the chat box. For agencies having on-site visits and have contracts with other agencies, will you be visiting all of the PATH program sites or the lead agency only?
Do you want to take it or do you want me to take it?
Usually, I'll take it and you'll correct me if I'm not. Usually, we visit the primary site only, and we've in the past had people from the other agencies come to the agency. But usually, when we do the visits to the clients, when we do outreach with the staff, we will go with the staff from the primary agency and do that.
So just, I think it depends, right? Like, so if we already did outreach with the primary agency staff previously, right, we might choose to do outreach with a different team and have that other agency host the site, right? Like, so it really is going to depend, and we will work out all those details with DEMIS and with the primary agency in advance. So Shannon's right that in the past, because we haven't done this that many times, we've usually hosted, the primary agency is hosted, and that's where we focus, but that's not always going to be the case. And regardless, staff from all of the, we'll review records from all the agencies, and staff from all of the agencies are going to need to participate, even if we only are doing outreach with one of the agencies.
Right. Okay, but again, with the monitoring guide, there are not a lot of changes for 2020. We're going to review the changes in the upcoming slides. And for your, DEMIS understands that when the requirements are new, projects likely will not have had time to implement the new things prior to 2020 monitoring. So Housing Innovations will note the new requirements and if they're met or not met in the reports. But it's not expected that that will all be taken care of before this monitoring. Next slide. So the sections listed here, the 2020 monitoring guide sections, are the same as they were in 2019 guide. Visual observations, something we look for example, are you keeping records in a confidential manner? Are they properly stored? We look at written policy. Administrative requirements, something we look at, for instance, is are you contacting and enrolling the correct number of participants, back to that IUP discussion earlier. And if there are requirements that you're not implementing, have you received waivers from DEMIS, and do you have documentation of those waivers? Then eligibility determinations, outreach engagement. Are you doing housing-focused case management services, and are you coordinating with community partners? We'll go through the changes in each section in upcoming slides. The reporting key for the monitoring guide doesn't have any changes, but just to remind you, the findings that are highlighted in pink are considered significant findings. So if you have a finding in pink, submission of a corrective action plan is required, and we will send a template and instructions for the corrective action plan with your final report. Findings highlighted in yellow are considered non-compliance with path requirements, findings should be corrected, but it's not required in the corrective action plan. And then areas highlighted in green are best practice recommendations. So they are things certainly to strive for, but action is not required, and no documentation of action is required in your corrective action plan. All right, I think we're going to hand the mic back to Lauren.
All right, so now we're going to go through, does anybody have any questions before we start going through changes? Again, *6 to unmute, or you can use the chat box to ask questions as well. Okay, we're going to go through, we're going to go through the changes. So in the first two sections, the written, and actually the visual observation section also, there are no new requirements in these sections, but we did just want to take a quick minute to talk about, since you guys have all been monitored before, we get this question every year, right? You don't have to send us every policy that you've already sent us, right? So if the policy is exactly the same as it was last year or even the year before, you haven't changed the policy, and you had no finding related to that policy, you don't have to resend it. So you're welcome to, but we're not going to look at it unless you indicate that it's changed or there was a finding. So, so usually what I suggest is that when you get that document request form for us, that lists, that's a standard form that we use for every project across the state, right? So look at that. Look at your final report from last year, and only send the things if the policy either changed or there was a finding. So for example, let's say in 2018, you had a finding because you didn't have the required educational rights policy, right? The policy that goes through what children and young people's educational, McKinney-Vento educational rights are, right? So if you had that finding in 2018, and you didn't submit a new policy in 2019, that same finding is going to be carried forward on your 2019 report, and your report's going to say that this is a finding, and it was also a finding in 2018. So in 2019, if your agency, in fact, developed a policy or changed the policy to make it compliant with the requirement, submit it to us, and then we'll remove that, and then we'll remove that finding, okay? Does anybody have any questions about that? Okay. If it's easier for you just to submit everything, just submit everything and we'll weed through it. So this is the item I think that we had a question about earlier. So the outreach plan template that you guys requested, you know, we worked with Demas and with you guys, and it's done and now available. And so now in the monitoring guide, we added a standard because that template, Demas did decide to make that template required. And so we added a standard in the guide that says that not only do you have a plan, but that you used the required template. And again, the expectation is, I can't remember if we're monitoring any past programs before March 1st, we may be, but we would only be looking, the outreach plan, having an outreach plan itself is not a new requirement. That was a requirement last year as well, but use of the required template is a new requirement, and we would look for use of that required template after March 1st. And that goes back to slide number 10, which outlines the implementation timeline for all of the new tools. We also added last year, again, the plan was required and it required CAN approval, but it did not require Demas approval, so that got added this year. And this is, and then you can see here, there's a link to where this is available on the CTBOS website. So I'm just going to really quickly go over some of the key information that you're required to put on your. Actually, no, I'm going to do the next slide first, and then I'm going to do that. Right? Okay. So these are just the steps that you would need to take in order to complete the plan, and then after we go through these steps, I'll go through what information is on the plan. Right? So we talked about this earlier, Stuart asked, or someone asked a question about this earlier. So you've got to determine whether you're going to have one plan for the entire CAN, or whether you're going to break up your CAN and have one or more regional plans that together cover the entire plan, right? So you've got to cover the entire CAN, but that can be through one or more plans, right? So once you make that decision, with your, your primary agency or with your CAN, then you're going to, talk about the plans at your CAN and fill out the forms. And we're hoping that can be a pretty collaborative process with all of the different stakeholders that are working with unsheltered folks within your CAN. Although I'm sure one agency, probably the task lead agency, will have to take the lead on doing that. Then you're going to have somebody at your CAN sign off on the plan. Once that person once the CAN representative signs off, you're going to submit the plan to DEMIS for approval. And then the requirement is, and this is not a new requirement, this was in the guide last year as well, that a supervisor at your agency reviews the plan monthly, and maybe it doesn't need any changes, and then they just sign the form to say that they reviewed it, or if it needs some changes, they make those changes. And that every 6 months, you resubmit the plan to CAN and to DEMIS for approval. So, and again, the initial plans are due to DEMIS on March 1st. So I don't know if people have the plans that we sent out in front of them. It's okay if you don't. I'm just going to go through quickly some of the things that are in there. So the first section of the plan is the canvassing schedule. So that's really where you're going to say, when, and the plan is not necessarily going to be just one agency, right? Because if there are multiple providers who are doing street outreach in that region that's being covered by the plan, it would include the schedule for all of those providers, not just the agency that's filling out the plan. Because again, the idea is that we are coordinating so that 2 agencies aren't covering one area on the same afternoon and another area no one's going there for 3 months, right? So that's the idea here. So you're going to fill out and say, what your canvassing schedule is. And some CANs are already using something very similar, just not necessarily in this template. Who's going where and when they're going to go there. The next section is the in-reach section. So that's, basically the same concept, but rather than, we're going to go behind Walmart and we're going to go to the woods encampment at, South Street Park. In the in-reach, so that would be the canvassing schedule. The in-reach schedule is where you're going to your indoor locations, right? So somebody's going to go to the library on Main Street every Tuesday morning, right? Somebody's going to go to the soup kitchen every Thursday afternoon. Somebody's going to go to the train station twice a week, right? And again, it's not just the staff at your agency. It's the idea is that it's coordinated among all the agencies that are doing in-reach for homeless people, right? Because people might be doing in-reach in other kinds for other types of populations, but for homeless people in your area. The next section of the plan is talks about which are the most vulnerable people in your CAN, and this is not meant to be we know that all of your people are vulnerable, right? Anybody that's living outside or in an abandoned building is vulnerable. That's not what we're talking about. This shouldn't be a list of every single client that's enrolled in PATH, right? It should be the 5 people, I'm just making up that number, right? But like the small group of people who you are most worried are at extremely high risk of a very bad outcome, right? It's the guy who has a festering wound on his leg that you're, afraid is gonna, die on the street, right? It's like that level of concern. And so sometimes I think the concept here is maybe a concept that you guys are familiar with calling like a hot list, right? Who are people? It might be somebody, it might just not just be a physical thing, right? It might be somebody that the last time you saw them, they were on the path to serious decompensation and you're worried about them being a danger to themselves or others. And so you're going to make sure that somebody goes out and checks on them at whatever frequency is possible and seems prudent, right? And it's going to be, different from person to person and from CAN to CAN, depending upon what resources exist. The next section on the plan is the case management plan. And so this is the place on the plan where you're going to say whether or not you're providing full case management services, and we'll talk in a minute about that, what that means to everyone that's enrolled, or if you don't have enough resources to provide full case management services to everyone that's enrolled, what's your targeting strategy? And I'm not going to go through it now because we're going to go through it on a future slide, what some of the targeting strategy options are. So, so that's where you do that. And then there's a section of the plan. Now, all of you are covering an entire CAN, right? And there are going to be some regions within the CAN where going out and physically canvassing the streets or even going to the library and doing in-reach isn't going to make sense because you pretty much know there are no homeless people there because it's maybe a very wealthy area or it's a very remote, wooded, secluded area and there are just no people there, right? So, but in some of those places, it may make sense to periodically check in, right? Because you don't know what you don't know, right? So you're going to have a strategy for how you're going to keep in touch with kind of key informants in those areas. So maybe the librarian, instead of actually going to the library once a month, because for the most part, that's going to be a waste of your time, you're going to call the librarian, you know, every quarter and just check in to remind him or her that you're out there and to see whether or not there are any homeless people that are using the library and whether or not it makes sense for you to go out there, okay? So that's the idea behind the phone email outreach schedule. The next schedule is where, you know, you're gonna try and, you know, help your staff to carve out some time for other things that they have to do that are critical, right? So that might be, you know, on certain days they have to go to CAN meetings. You're probably going to want to carve out some time when they can do some documentation, right? So that's the next schedule is for the other tasks that your outreach staff are doing. And then the next section is the coverage plan. So that's what are you going to do if your outreach worker suddenly gets pneumonia and can't come to work for a month, right? How are you going to make sure that the most vulnerable homeless people, that there's some plan for continuing to serve them? And the next area is if there are areas in your CAN that are not covered in the plan, right? And that might be, you know, whatever, it's a very wealthy area and it just, it does not make sense to have any kind of, use any resources to do anything in that area. You're going to list those areas here, right? We're just not covering that area and here's why. And then you're going to also, if there are areas though that are uncovered and it really just is a resource issue, like it probably should be covered, but you just haven't figured out how to cover it yet, you're also going to talk a little bit about that and if there are any plans for covering that in the future. Systems gaps, I think that's a thing that you guys asked to be added. So that looks at who are the stakeholders that really should be involved in helping to engage and prevent and end unsheltered homelessness, but who are not currently at the table that your CAN wants to try to engage. So that's a section that we added. The emergency plan, so that's like, you know, what's your protocol for, you know, I don't know, it really is going to depend upon your area and what kind of emergencies are common, right? If you've got a river that floods frequently and there's an encampment at the side of the river, right? What are you going to do when there's a flood risk and those people are at extremely high risk of drowning, right? What are you going to do in advance to try and get them into shelter? And there are different examples of the kinds of emergencies that might happen. Some are always going to be relevant. So like extreme cold weather is always going to be relevant in Connecticut. Extreme hot weather is always going to be relevant, but some may not be relevant to your area, like flooding. Engagement supplies. So that's just, you know, what kinds of supplies are available to, you know, hats, gloves, blankets, water, et cetera, to help, you know, keep people safe and also as an engagement tool. The last section is public awareness and PIT, right? So how are you working with your CAN? And it might not be your agency that's doing it. It might be someone else in the CAN that's responsible for it, like 211. I know in some communities there are billboards up where 211 is advertising, but how are members of your community that are not already connected to the homeless services system, how do they know who to call when they come across somebody that's homeless in the park and that they're worried about? And then how are you going to respond to those calls? So what are you going to do when you get those calls? And then lastly, how do you work after the pit? Sometimes in the pit, volunteers find families with young children, and we want to make sure that there's a plan to respond quickly, to know where those families were found, and to respond quickly to send somebody out to help those families, or it doesn't necessarily have to be families, any particularly vulnerable person that's found during the pit that requires immediate follow-up. So, and then the last section is just the sign-off section. So there's spaces for the supervisor to sign for the monthly reviews, and then there's a place for the CAN representative to sign and for the DEMIS representative to sign. So that was a lot of talking, and now I'm going to be quiet and see what questions you guys have.
Press *6 if you want to ask your question by phone.
No questions? All right, I'm going to keep moving. If you think of questions as we go, please jump in or contact us after, or Brenda after. So we're almost done. We've got about 20 minutes left. We will definitely finish right at noon, if not sooner. So outreach and engagement. So these are just a couple of other changes to the guide in these sections. So last year there was a lot of confusion because the guide used to say that all contacts had to be documented in HMIS, and whether or not that's doable, how one would do it. I think there was just a lot of confusion on that, and I know DEMIS is working with CCH on what some of the options might be there. So the guide now just clarifies that that DEMIS does want you to document all contacts, right? That's necessary. SAMHSA, you need that for your annual report. So you've got to document all contacts, but that doesn't necessarily have to happen within HMIS. I guess if it happens outside of HMIS, then you need another way of keeping track of it so you can get it into the annual report. So, and then this isn't new, right? So it also requires that contacts with past enrolled clients be recorded in HMIS. It's just the clarification of what has to be in HMIS and what's optional to be in HMIS. This slide really is just, so these are kind of all of the areas of housing-focused case management that we look at when we come out. These are not new, right? These are all the areas that we've been looking at for the past few years. So I'm going to move on quickly from this. So this is new. So what's new in 2020 is that you guys had asked for a template that you could use to do very brief assessments and service planning. And so we worked with DEMIS and developed a template. And so the requirement to do assessment and service planning is not new. That's been a requirement for several years now. But but using the template, that's what's new. So DEMIS has requested that everybody uses the template that we developed. So that's new. The other thing that's new that we talked briefly about earlier is that in some cases, you guys just don't have sufficient staff resources to be able to do assessment and service planning for every single client that you enroll. So, the guide now enables you to have a targeting strategy. So it's one of the things that's in the outreach plan. And I'm just going to go to the next, whoops, that's the wrong slide. So what do we mean when we say a targeting strategy, right? Like if you've determined that you've got, and I'm just making up these numbers, right? You've got 2 outreach workers and it's only possible for them to do assessment and service planning for 12 people at any given point in time, each of them. So then that means you can do this for 24 people, but you've got 50 people enrolled, right? So which of those 50 are you going to do assessment and service planning for? So, and these are just examples. These are just options. These are not saying that this has to be the targeting strategy. So one possibility might be that you work with the CAN and you're going to target the clients who are most vulnerable or who are homeless the longest. Another possibility might be that you're going to prioritize or target the clients who have been prioritized by the CAN to receive a housing intervention, right? Their name has come close to the top of the by name list, and you need to really be working with them closely to do all the housing search and navigation work to get them housed, right? That might be a thing that you would do in your CAN. Another possibility is that you've got some people enrolled who are literally not even willing to give you their name, right? Like, they're not even willing to say a word to you. You're not going to be able to do assessment and service planning with them, obviously. So you might target the people who are more willing to participate. Now, that certainly doesn't mean, obviously, that you guys don't continue to try to build that relationship and engage those other people. But until you've built that relationship, it probably doesn't make sense to try to do service planning with a guy who won't even give you the time of day. So, yeah.
I'm sorry, it's Brenda. No, I just wanted to, you just gave one example about the targeting strategy, maybe within the CAN, if it's like people who are coming up on the by name list and they might need some housing services and resources. I just want to note that we still really want to focus on the unsheltered. That's clearly the biggest population that needs these services because there's nothing else touching that population. So I would just mix and mingle some different cases in if that's where the CAN wants to go with the by name list. I don't want it to be all people who are in shelter but on the list to be housed.
Oh, okay. Sorry, but I should have been clearer about that. So what I meant when I said that was the people who are unsheltered and came up on the by name list.
Perfect.
Yeah.
Thank you.
So we can clarify that on the slides before we post them. But that's what we mean, right? Like, so the clients that are already, you're already engaged with that are unsheltered, you might prioritize them for not the people who are sheltered.
Yes, thank you.
Okay. So, all right. And again, just going back to the yep, go ahead.
So, certainly we know that anyone that's that's in a shelter bed, we're not supposed to work with them, correct?
It's not necessarily that hard and fast, right? In some CAN, it really depends upon your CAN and what's in your IUP. In some CANs, actually, there are very limited or no case management services available in shelter. And so then in the IUP, it does say that part of the outreach worker's responsibility is to provide some case management to some of those folks in shelter. So it really depends upon what's in your...
That's negotiable, right?
Can I just jump in? I'm sorry. So anyone who gets any shelter that gets DOH funding also gets case management funding. So I would just tread lightly on that because people in shelter should be getting the services taken care of there. So I would almost hate to use the PATH services on a population that already should have services involved. Now, if you're in a community with a shelter where you're getting a lot of referrals to PATH because they're saying the shelter's case management can't handle it or they can't do it, I would really like you to communicate with me so I can communicate with Department of Housing on that because we have limited resources. I'd rather use PATH outside since there's already paid funding for case management and shelter.
So I totally hear you, and it gets a little sticky at times, but I totally hear you on that. The other thing is you're talking about when, we only have one PATH worker, one outreach worker. We don't have a hot team. We're Norwalk. Norwalk's fairly big. So if the PATH worker is overwhelmed and has people just coming at him or her and is at a point where in order to do good work with the people that they've enrolled, they cannot take on any more people, what would you suggest?
That would probably have to be a different conversation, perhaps at the next statewide meeting, because I know we're limited on this webinar. So maybe we can kind of discuss some troubleshooting around, again, what resources are in the CAN, what other programs are available. Maybe we could talk offline, or we could put that on the agenda for the next statewide meeting.
Okay.
There's a question in the chat. Excuse me. through this question in the chat box, which I think we covered, but Diane corrected me or asked a more question. So Diane says, is this duplicating this discussion about providing case management services to people in shelters? I think she's referring to what CAN navigators are doing. So do we think that was addressed already?
So I think the idea is that we're not duplicating, right? So if in your particular CAN, there aren't enough CAN navigator services to be able, like every targeting strategy that we put up there is not going to make sense for every CAN, right? So those are just some options, not necessarily what you're going to do in your CAN. So if your CAN has navigators and those navigators are able to do the navigation for all the unsheltered people and that's working swimmingly, then no, then you wouldn't use that targeting strategy. You'd use a different targeting strategy because the idea is not to duplicate.
Mm-hmm.
Does that?
Yeah, okay. That sounds clear. So, Diane, add something if you have an additional question.
Okay. So, so housing focused case management. So this really is just clarifying that assessment and service planning, the use of the template is required for everybody that you've enrolled or everyone that you've indicated in your outreach plan that is going to get targeted, right? So you might say in your outreach plan, we're enrolling 50 people, but we only have enough resources to do assessment and service planning for 20, and this is the targeting strategy that we're going to use. As long as that's approved by the CAN and by DMIS, when Housing Innovation comes out to monitor, we're only going to look for assessment and service plans for 20 people, right? So you'll tell us which are the people that are getting it, and we'll only look for it for those people, right? But that's not to say, of course, that all the other requirements in the guide don't apply to all the other people, right? So just because you're not doing assessment and service planning with someone doesn't mean that you're not using the housing approach first approach with them, right? It doesn't mean that your teams are, not making referrals to community-based services for them, of course, right? So the targeting really is limited to assessment and service planning, right? It limits the number of people that you have to do the assessment and service planning piece with. Okay, this is another thing that came up last year. There was not a lot of clarity about what the discharge criteria were for the past programs, and so we tried this year in the guide to clarify. So basically the criteria that are in the guide now are that you discharge when you've not been able to make outreach contacts in the past 90 days, right? And again, you're gonna document attempts, right? So you're gonna show in the record that, you tried to find the person, but, you weren't able. We'll talk about exceptions to these things in a moment. You're going to discharge somebody if they've been placed in permanent or transitional housing for more than 90 days. So we did see a couple of instances in the last few years where we had outreach workers who were still engaged with folks that had already been in PSH for 6 months or even longer than 6 months. And again, because these are such scarce resources and those other programs have designated case management resources, we know that the clients love your workers. We know that the workers love the clients, but we really do want to try to help those people to move on and do some more hands-off so that they engage with the case managers wherever they're living. If somebody, somebody is going to jail and they're getting a 6-month sentence or a year sentence, right? You're gonna discharge them. So if the period of institutionalization is anticipated to be longer than 90 days, then you're gonna discharge them. But that doesn't mean that you have to wait 90 days, right, on either of these things. So you could discharge someone on all three of these things, right? So you could discharge somebody before 90 days. So for example, if somebody moves, to France, probably doesn't happen often with your clients, right? You're going to discharge them, right? If somebody is placed in permanent housing and they're doing really well, you might discharge them sooner than 90 days. So obviously if somebody dies, you're going to discharge them. And then if they, if they're transferred to a different project, right? A different path worker is now working with them, or even a different case manager from a different kind of service, you might discharge them. They no longer need your help. And then obviously if somebody insists on being discharged, you're going to continue to try and encourage them to stay engaged. But if they insist, you're going to discharge them. All right. So, and then there may also be some exceptions here where you're going to go beyond the 90 days. And for those, you're going to get approval from DEMIS. So let's say you've got somebody, you've been trying to find them for 90 days and it's now, 110 days and you've not been able to contact him, but you know he's around, right? You keep leaving messages at the soup kitchen worker says, yeah, he's around. He says he wants to talk to you. You just haven't been able to connect with him. You're probably not going to discharge that person in that circumstance. Or you've got somebody that's placed in permanent supportive housing or transitional housing. They're really, really vulnerable. It's not going well. They're not staying in the apartment. They're going back to the encampment, right? That person you might keep enrolled. And again, just, shoot Brenda an email and just get that approved by Brenda, and we will consider that, we will obviously wouldn't be a finding if it was approved by DEMIS when we come out and we monitor. All right. So we're almost done here. There are no new items in this section of the guide. I think people have been asking questions all along, but certainly if there are any remaining questions, we're happy to field those now.
And if you want to ask a question by phone again, press *6 on your phone, or you can enter them in the chat box.
All right. Here's our email addresses that you can reach us at if you have questions that we weren't able to get to today, or things that you think of after that you want to ask. Please reach out to one of us. And we appreciate your time today. We know you guys are super busy folks. Like we said, we are going to post this to our website, and so it will be available if folks weren't able to join or you've got new folks that join your team. And then we will be sending out a survey via SurveyMonkey, an evaluation. So please take a few minutes. It'll be short. Please take a few minutes to complete that, because it really does help us to make these sessions better for you guys. So with that, Brenda, I don't know if there are any closing remarks you want to make.
I wanted to say thank you. It's been great working with all of you and really jumping in and kind of figuring out where the gaps in the system are. Please, if you've been in your own locations today, kind of chatting through this webinar and maybe having questions that you didn't ask, please email them. I mean, again, this is a collaborative effort. We want Connecticut to do the best we can with this funding. So maybe they can, increase it, or the feds can see, oh, look, Connecticut's doing it right. Let's help them here and there. Like, it really helps. So just please remember this is a collaborative effort and all hands on deck. So please communicate any questions, issues, challenges.
So, and Shannon and I think Brenda's going to be joining us on some visits. So we look forward to those of you that were coming out to visit in person. We look forward to seeing you. And for those of you that we're going to be monitoring remotely, we look forward to seeing your video of you anyway on Zoom. So, all right, I think that concludes our program today. And thanks again.
Thank you.
Bye, everybody.
Thank you all very much. Bye-bye.